If you're looking for a sign to go to the hospital, this may just be it. My name is Dr. Jordan Wagner, and I'm a board-certified emergency medicine physician with a YouTube channel called Dr. ER. And of course, if you think you are experiencing a true emergency, please call 911 or your country's emergency equivalent, and or get to the hospital immediately. If you are still unsure if you're experiencing a true medical emergency, never fear. I put together a list of 5 reasons that you or someone you love should get to the hospital. Number 5, trouble breathing. You huffing and puffing, having a difficult time breathing suddenly, wheezing, or having any kind of out of the blue shortness of breath, you may want to have 911 on speed dial, because this sudden onset of shortness of breath may indicate something much more serious that requires immediate medical attention. Definitely get to an emergency room if this is the case. As an ER doc, when I hear a patient is having a sudden onset of trouble breathing, there is a laundry list of medical conditions that could cause this that need to be ruled out, especially the bad ones. Things like having a heart attack, blood clot in the lungs, problems with your aorta, and other lung problems like collapsed lung, asthma complications, chronic obstructive pulmonary disease or COPD, heart failure, infections in the airways like croup, bronchitis, pneumonia. The list goes on and on. Not to scare you, but trouble breathing is very serious, and we need to rule out the potential life-threatening causes for your sudden shortness of breath. A normal level of oxygen in the body is usually 95% or higher, but if your oxygen levels drop below 90 to 95%, or you just feel uncomfortable and are having trouble catching your breath, definitely get to the hospital now. I repeat, definitely go to the hospital. Number 4 reason you should go to the emergency department, chest pain. If you have chest pain that lasts longer than 5 minutes and doesn't go away, even when you rest or take medication and you're still having this pain, this could be an issue, especially if you find that your chest pain is paired with shortness of breath, cold sweats, nausea, fatigue, lightheadedness, or any other pain that radiates out to the body parts like your arms, for instance. Your chest pain could be due to things like a heart attack, coronary occlusion, an aortic dissection, an aortic aneurysm, rib injury, anxiety, among many other serious life-threatening issues. If you or one of your loved ones thinks they can just ignore their sudden onset of chest pain or, quote, work through it, don't be that person, please. Get to the emergency department. Number 3 reason, displaced or open wound fractures. Fractures in doctor speak just means broken, and displaced fractures can either be open or closed. When you break a bone, the skin is sometimes intact, aka closed fracture, or if the bone breaks through the skin, that in doctor speak is called an open fracture. But no matter what you call it, if you break something in your body or have a suspicion you or someone you love broke a bone, seek medical attention right away. Then we'll decide whether you need to have it splinted, sling it, or whether you may require a reduction procedure or surgery to put the bones back in place. It's also important to get checked out because you want to make sure that the displaced bone isn't doing anything bad like cutting off the blood supply somewhere or pinching a nerve for that instance. And it's also important for pain management. Even if you don't really have pain now, not properly taking care of a bone fracture can cause major issues down the line. Get treated today and you'll minimize things like growth issues, arthritis, osteoporosis, and other pain in the future. Have you ever broken a bone? Let me know which one, and let me know what your experience was like in the comments below. Number 2 reason to go to the emergency department, sudden numbness or weakness. Numbness in the body usually happens when there's a lack of blood supply to an area, nerve compression, or even nerve damage. Kind of feels like pins and needles in your body. That sudden feeling or numbness can also result from infection, inflammation, trauma, and other life-threatening issues like a stroke. If this is happening to you or someone you know, pay close attention. If you feel numbness, particularly that is occurring on just one side of your body, you need to get to the ER immediately. Certainly, there are other neurologic conditions that may cause numbness, but my concern when I hear sudden numbness or weakness on one side of the body is always stroke. This is very serious and could be potentially life-threatening. Strokes are the number 5 cause of death in the United States. They can occur when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. When this happens, blood and oxygen can't get to that area of the brain and the brain cells start to die. So to avoid further complications or other potentially disabling outcomes, if you feel numbness or weakness in your body, play it safe and call 911 or seek immediate medical attention. Number one reason to go to the emergency department: anything you're concerned about. Sometimes serious medical issues aren't that obvious. Maybe your symptoms are a little vague, or maybe someone is telling you to just ride it out. Say a sudden onset headache, especially if someone is on blood thinners, seizure, sudden inability to speak or walk or move, sudden drooping on one side of the body, pain in your arm or your jaw, car accident, kitchen knife accident, anything at all that seems suspicious, or on the opposite end of the spectrum, symptoms or pain that just comes on out of the blue. That's what we call acute symptoms. They just pop up and cause a person sudden pain and discomfort. This could be your body's sign that it's telling you it's time to seek medical attention. Here's what it all boils down to. The symptoms that I've listed out are not a complete listing, but rather an overview or guideline to try and help you assess whether you or your loved one is at risk. Is it better to get to the emergency department and be wrong, but have the reassurance that the symptoms were not life-threatening, then completely ignore the symptoms and put yourself at risk? Believe me, I've seen people sort of ignore their symptoms and the situation turns out to be a lot more dire than they originally thought. Headaches that turn out to be brain bleeds, or an allergy and shortness of breath symptoms that turn out to be a heart attack. All the time, I see this in the emergency department. So give yourself the peace of mind and either reach out to your healthcare provider, call 911 for an ambulance, or get to the hospital immediately if you have any of these symptoms I've mentioned. All right, that's been a quick breakdown of some of the signs you should go to the ER. Certainly, there are a ton more. If you want me to do a follow-up video to these, please hit that like button and let me know in the comments. I have a lot of valuable information when it comes to emergency medicine that I cannot wait to share with you, and hopefully it takes some of the fear and the unknown out of the medicine, so that way you can be a better advocate for your own health. Well, let me know in the comments if you've ever made a trip to the emergency department and what was that experience like for you. Shout out to Nucleus Medical Media for their awesome video library and graphics. This video was a collaboration between them and my Dr. ER YouTube channel. Subscribe to both channels. Thank you so much for watching and stay healthy, my friends.